I'm Sheena Larson, and today I'm going to be discussing recumbent patient care. I have my boy Kane here with me to help me demonstrate. To start off with, I'm going to demonstrate some passive range of motion exercises. So you want to start with the most distal joints and work your way proximal. For the pelvic limb, this means starting with the toes, flexing and extending, and then the hawk, extending and flexing, and then moving on to the stifle, flexing, or extending and flexing, and then onto the hip. You're wanting to keep the limb parallel with the ground so that you're not putting any torque on the joints, and you're wanting to move within what the patient finds comfortable. So flexing the hip and extending the hip. There we go. And then for the thoracic limb, you also want to start at the distal joints with the toes. If this were not just a demo, I would be holding the extended joint for 10 to 20 seconds and the flex joint for 10 to 20 seconds and repeating that 3 to 10 times. And then onto the carpus, you want to flex and extend, and the elbow, you want to flex and extend, and for the shoulder, you want to flex and extend. So we would repeat that, and ideally we would also rotate him onto his other side and use the other limbs as well. Now I'm going to pretend that he is semi-comatose and potentially has a regurgitation issue. So he's still in lateral recumbency, and it would be important to elevate his head to keep his airways open, but have a slight downward angle to allow for any vomit or regurgitation to drain out of his nose and mouth. So I would elevate his head. Stay still, baby. So I would elevate his head by putting a rolled towel underneath his neck and then allowing the head to angle down. And if he wasn't so curious for what I was doing, lay down. There we go. You can see that his nose and mouth are at a downward angle. So, and I would make sure that the bedding is not obstructing his nose or his mouth. You can then also take other towels and put them at other pressure points. So in between his carpus and his elbow. Stay. You were being very good. Stay. So in between his carpus and his elbow. In between his stifle and his hawk. And this is for patient comfort. And then also underneath his keel. So this provides a little bit of extra support and takes pressure off of any points if he was to be in this position for an extended period of time. So it reduces the chance of decubital ulcers from forming. If he was a patient with a traumatic brain injury, he would be treated slightly different. For a patient with a traumatic brain injury that's in lateral recumbency, the head and neck should be elevated 15 to 30 degrees above the rest of the body to facilitate cerebral venous drainage and to decrease intracranial pressure. So it reduces the amount of blood in the cranium. So I would use a board, not necessarily a towel, something stiff, to elevate the head, because a towel can obstruct the blood vessels in the neck, and it can prevent them from draining. And if he was to be at an angle greater than 30 degrees, then that can decrease cerebral blood flow. For a patient in sternal recumbency, I would prop them up in sternal recumbency for their thorax, and then have their hips in lateral recumbency, in this case right lateral. I would use some towels to keep them propped up into position. So just roll up some towels and put it under their chest. In order to get him into sternal, he's a big boy, so I would have help, have an assistant just gently support him while we rotated his hips underneath him back and forth, so that we could rotate him into different positions. You can, for towels, you can use towels, and you can also use foam wedges or sandbags. And right now I'm not going to try to manipulate him too much, because I think that that would freak him out. So I would take one of the towels and I would place it underneath his head to open up his airways, just like that. And I would make sure that his nose and mouth are not obstructed by the blanket. You just lay facing forward for me, bud. There you go. And then I would place some of the rolled up towels underneath his elbows. Oh, sorry, bud, stay. Any of the downward parts of his anatomy, head down, head down, there we go. Any of the downward parts of his anatomy that could have pressure, I would put a towel under to provide support. So underneath his heel, I would add an extra towel underneath here, underneath his hips. Okay, okay, head down. There you go. And you want to keep the joints at a natural angle and just provide extra cushion to reduce the amount of pressure. So patients should not stay in one position for longer than 4 to 6 hours, because there's an increased risk of atelectasis and formation of decubital ulcers. Rotating the patient, even if it's just their hips, helps to reduce pressure that's being put on the areas. For atelectasis, the lungs on the side that the patient is laying on has a risk of, partially collapsing due to the pressure. And decubital ulcers or pressure ulcers can form when there is a constant pressure on certain areas, so like the elbows or the hips or the hocks, anywhere if they're laying in one point. So that's why we have added extra cushion in those areas. So if you move the patient frequently, it helps to keep pressure off of those areas. Okay. And it allows for normal blood flow and normal airflow in the lungs.